Hi, everybody. Dr. Evan Hirsch here to talk to you today about the thyroid test that I like to run. These are the top 7 tests. Okay, so we're going to go through these one at a time, and you're going to be incredibly surprised about what number 7 is because it's not what you think. So let's jump in. So let's start off with TSH. So thyroid stimulating hormone. This is the message that comes down from the brain, goes to the thyroid, and tells the thyroid to make thyroid hormone. This is the test that's mostly done by conventional practitioners. Oftentimes, that's the only test that they do. Now, unfortunately, this test is accurate initially when you test someone before they start taking thyroid medication. Because once someone starts taking thyroid medication, oftentimes that message of more thyroid building up in the body sends a message to the brain and lets the brain know, hey, you don't have to make any more thyroid. So then that message, that TSH, starts to decrease because the brain is like, okay, well, I'm good and I can relax. Now that TSH is no longer accurate. So we'll get what are called suppressed TSHs, where the TSH is all the way down. And it looks like that brain is no longer communicating with the thyroid, but that's not what's happening. It is just getting quiescent. It is getting quiet. It is relaxing because you're taking over production of the thyroid in the body by taking a thyroid medicine. So that's the first one, TSH. And the level that I want of that one is 0.5 to 1.5. So if it's above 1.5, it indicates that there's not enough thyroid floating around in the body and that the brain is essentially yelling at the thyroid to make more thyroid. In conventional medicine, they generally want this number to be above 4 before they start treating, but I have found that that number is way too high. So I look at 0.5 to 1.5, and it's very individualized. I have some patients who prefer to be at 0.5, some patients who prefer to be at 1, and some patients we can't use the TSH at all because it's not accurate when they're taking their thyroid medication. Next, let's talk about free T4. So when we're looking at our hormones, we always want to look at the free fraction of hormones. So the free fraction is the bioavailable. This is the hormone that is available to use readily, one that can affect change, that can change the function in the body that is most important for you to use. So we're going to look at free T4 and free T3. So free T4 is the thyroid that is mostly made, and then free T3 is the active form that is converted at the cellular level and in the liver. So those are very important numbers. Now the free T4, we want it to be between 1.2 and 2, and free T3, we want it to be above 3.0, generally between 3 and 4 or 3 and 4.5. Next up, so those are the main ones that I'll use. And then less frequently, and remember, this testing is important, but it's not the whole picture. So the whole picture is the patient's history, their symptoms, the signs on their bodies when you do a physical exam or you look at them, and then the lab testing. And when I'm teaching doctors, I tell them, if you lean too heavily on your labs, you're going to fall over. And that's because all of our labs are imperfect, and we always have to take them into the context of what the patient is experiencing. So the next lab I want to talk about is reverse T3. So during times of stress, and that could be either mental, emotional stress, or it could be a physical stressor, like what I call the usual suspects, which are heavy metals, chemicals, molds, infections, allergies. All of those things can stress the body. And then your T4 will start getting converted to reverse T3 instead of to T3. And the reason why this happens is because during times of stress, the body thinks that it's starvation time, because this is the way that we evolved. Generally we had stress that came from either we were being chased by a saber-toothed tiger or we didn't have enough food to eat. So what reverse T3 does is the opposite of T3. It shuts down our metabolism. And so oftentimes when you have one of those stressors, we find that reverse T3 is elevated, and we have to deal with those stressors in order to fix that problem so that T3 can then be converted, or T4 rather, can then be converted to T3 instead of to reverse T3. Next up are the antibodies. We want to look at thyroid peroxidase antibodies, or what's otherwise known also sometimes as thyroid microsomal antibodies, and then also antithyroglobulin antibodies. So these antibodies are the immune system that is attacking the thyroid. And when these are positive, when they show up on your blood testing, this indicates that you have Hashimoto's thyroid disease. So Hashimoto's is just indicating that it's an autoimmune component or autoimmune disease. So the immune system is attacking the thyroid. Now, 90% of all low thyroid is autoimmune. So I don't always have to check those antibodies to presume that it is autoimmune, especially if there are other things that make me think that there's autoimmunity in the body, like someone also has rheumatoid arthritis or some sort of other autoimmune disease, or the immune system is hyperactive. So that's the top 6 there. So we did TSH, free T4, free T3, reverse T3, and then the 2 antibodies. So can you guess what the 7th is? The 7th is actually cortisol. So this is an incredible surprise to everybody, because you have to know what the adrenals are doing in order to know what the thyroid is doing. So cortisol is the adrenal gland's main hormone, and it allows us to get up and go in the morning. It gives us energy. It helps regulate our blood sugars and metabolism and all these amazing things that are so important in the body, but it also supports the thyroid. And so if cortisol is low, oftentimes thyroid is going to be falsely elevated, which means that the thyroid hormones are going to be less than what they appear. And that's because they're compensating for the cortisol not being enough. And then when you boost the cortisol, you'll notice that you'll get a more real picture of the thyroid. So you always want to keep that in mind. And then it also works vice versa for the adrenal gland as well. So hope this was helpful for you. That's my top 7 labs that you should test for thyroid function. I hope this was helpful, and I hope you have an amazing day. Thank you for watching.